Hello, my name is Dr.Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at the Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. Today, I'll be addressing the question, what is the difference between a partial and complete response on imaging? Imaging studies such as CT, MRI, and PET are important tools that are used by your cancer care team to see the status of your cancer. Seeing the status of your cancer can mean determining the extent of cancer within your body. For example, which organs are involved, how many tumors are present, and how big are the tumors. These are questions that CT or MRI examinations can help answer. Seeing the status of your cancer can also mean determining how active your cancer is. For example, how quickly does the tumor pick up nutrients from your bloodstream as it attempts to grow and spread? This question can be answered with a PET scan. When we answer these questions, we get a sense of what the status of your cancer is at a particular moment in time. This is very useful information to have. But we are also interested in how the status of your cancer is changing over time. For example, how has the status of your breast cancer changed over the several months that you have been on chemotherapy? How much did your lung cancer shrink in response to radiation therapy? Or is your lymphoma still active? These are questions that radiologists can answer when interpreting imaging studies. The process of determining how your cancer status has changed during treatment is called response assessment. There are several systems that radiologists use when performing these response assessments. For example, the response evaluation criteria in solid tumors, or RECIST for short, were developed to standardize the way radiologists reading CT and MRI examinations measure tumors and assess the overall burden of malignancy in cancer patients. This is especially important for clinical trials testing new cancer therapies because determining whether a treatment is effective requires having a reliable way to measure the initial disease extent and identify changes in that extent over time. A similar system has been created for the interpretation of PET scans. This system is called the positron emission tomography response criteria in solid tumors, or PERCIST for short. Other more specialized systems have been developed for particular types of cancers with unique imaging features and behaviors. For example, the 5-point scale is used when assessing treatment response for most types of lymphomas. These systems vary in their specifics, but generally divide response assessments into one of 4 categories. The first category is complete response, or CR. This category indicates that there is no longer any evidence of cancer on your imaging study. Although a complete response doesn't always mean that the cancer is gone forever, it is definitely a great sign. The second category is partial response, or PR. This category indicates that the cancer is being killed by the treatment, but has not yet been entirely eliminated from your body on your imaging study. So even though it would be preferable for there to be no evidence of cancer on your imaging study, or in other words, a complete response, a partial response is certainly good news. With continued treatment or simply more time, some tumors that initially show a partial response will eventually show a complete response. The third category is stable disease, or SD. This category indicates that the cancer has not yet changed in its size or activity as a result of treatment, though that doesn't mean that it won't respond in the future with continued treatment. The fourth and final category is progressive disease. This category indicates that existing tumors are clearly becoming larger or more active. This category can also be used to indicate that a new tumor has developed. The implication of this category is that your current treatment isn't working in terms of killing or at least containing your cancer. This may prompt your cancer care team to consider other therapies.